So we're back with none other than Tista, our Head of Outreach at the General Medical Council. And Tista will be covering through a very, very significant topic that affects everyone going through medical school, and that's the situational judgment test. So Tista, I'm going to pass over everyone to you.
Brilliant. Thank you, Jono, and welcome everyone. It is great to be back with you. So as Jono says, I'm Tista. I head up outreach operations at the GMC. I'll introduce myself a bit more thoroughly in a moment for those who weren't at the morning session, but just to go over what we're going to be covering this afternoon. The aim really is, well, preparation, as you'd expect. And I really want to focus on the weight of our standards and guidance and how that can help you with your SJTs and how you actually apply what can sometimes appear to be abstract principles, how you can actually apply those in practice, which in turn helps you with things like your SJTs. I'll also signpost to some resources. So that's what we're going to be doing. It's going to be quite a quick fire session in the spirit of helping you prep for SJTs. So we'll be using Slido. So please do locate your Slido tab in the conference platform, and that's where we'll be running all the polls and all of that. But before we get started, by way of very brief introduction for those who weren't there earlier, I have been in and around healthcare for 25 years now. I work with survivors of abuse in the SARCs, those are the sexual assault referral centres that we have here. And I've done various other bits and pieces in healthcare, but about just over 10 years ago now, because of my interest in systems and how systems support our patients and clients, I was asked to, with a colleague, set up a support service on the ground for the GMC. And at the time, I remember thinking this is a really progressive thing for a regulator to do. So I jumped at the chance, and we now have an outreach service. There we go. We now have an outreach service at the GMC that's been running for about 10 years, and this is what we do. And I'll just pause and let you digest that for a moment. So this is the service that I co-lead, and wherever you are in the UK, whether you are a medical student or whether you are a practicing doctor, we have an outreach advisor as a point of contact who can come and do all of this. So if you are working in a department where you think actually we could really do with some more support around end-of-life care, around confidentiality and sexual health, whatever it may be, we can come out and provide any supportive intervention around that, from teaching to more in-depth discussion as well, because another really important part of the role is listening to what is actually happening on the ground and helping affect cultural change as needed. So that's what we do. And moving on now, let's focus on SJTs. So I want to start by asking you, what worries you about SJTs? So just type in any thoughts that you have on what worries you about your SJTs. So you can just type freely into the chat. We'll move on to Slido when we get to the polling questions, and I will have a read of what you're typing in. Okay. Any thoughts? Okay, so the outcome Munir is talking about here, about not getting into preferred deanery, absolutely. Anything about the SJTs themselves and how to approach them? Anything that you've heard? Any thoughts? Hang on. Okay, let's move on. I'm just seeing a couple of more thoughts come in. I'll just go through those. Complex scenarios, absolutely. Yeah, vagueness of questions, that's something that we hear about a great deal. Okay, and this is interesting that you can't really prepare for it, or that's what you've heard. Inconsistency, contradictory practices. Okay, all right, lots of thoughts coming in now. That's great. Yeah, and I would agree. This is something, what you've all said there, this is something that we hear by way of feedback. And I have to say, I remember when I first started delving into SJTs a number of years ago, I was quite concerned by the nature of some of the questions, and certainly in terms of that inconsistency and the approach that some of those questions take. And over the years, it has improved. Now, in terms of preparation, just going to that point about how do you actually prepare, can it be prepared for? The approach that I would take is look at the scenario and think about what you would actually do. And think about that based on what our standards and guidance say, and then move to the ranking or choose the best two or whatever the framing of the question is. And we find that that is the best way to prepare in these scenarios. So what I'm going to be doing is just talking you through guidance a little bit first, and then we'll look at some example scenarios, and we can talk through those. So first of all, the guidance to, if you will, hook how you respond to SJT questions on is good medical practice. And that doesn't just mean that central document there, but the supporting standards as well. And there are some key pieces that are particularly salient to SJT, for example, confidentiality, shared decision making, the consent guidance, and raising concerns. These are things that you'll see come up a fair bit in SJT. So those are the ones to have in mind. Now, we do sometimes hear that there is a perception, and you may have heard me say this before if you're there in the morning, that standards and our guidance are, well, in terms of ethics, common sense ethics. But as this next slide shows you, and don't try and read it, it's way more than that, because this is a list of all the pieces of legislation, 47 pieces of legislation there, that we distill to put into just one piece of guidance, in this case confidentiality. So the standards are complex, and it is the way the ethicists frame that legislation and frame the wider ethical framework that makes it a more digestible document for you. But unequivocally, they are the benchmark for practice, as well as the safety net for your decision making, as well as the lever for change. If you're working in an environment that doesn't let you meet the standards, then a number of colleagues across the system use those standards as that lever to say, hang on a minute, this is, these are my professional standards. I must, to use the vernacular of the guidance, meet these, but I can't in my current environment. So the standards are applicable in a number of ways. And now we'll run through the scenarios, the example questions, if you will, and see how we can apply those standards. So I'm going to start with a vignette from Dr. Prava and Jolie, and I won't read it out. I'll let you read it so you can focus. Okay, so a needle stick injury has been sustained by Dr. Prava. Jolie, the patient, is unconscious. So I'm going to move us to the question now. And can I ask you to launch, it's actually the second poll, please. And now if you move to your Slido, have a think about what you'd actually do first, remember. So Dr. Prava wants to use a sample of Jolie's blood to test for blood-borne viruses. Okay? What would you actually do? She's about to go and test that blood. What would you do? Think about what you do, and now move to Slido and rank the 3 most appropriate by order of priority. Okay, so sign into your Slido, or go onto the Slido tab. Oh, I can see some people are commenting that it's frozen at your end. Right, there's the Slido code, but you should just, yeah. Okay, brilliant. So it should be running. I can see one person is connected. So it should be running, but just the tab is right next to the chat. For those that can't see it, where you've got your chat, right next to that, you should have an option that says Slido. So just tap that. There we go. I can see some more people are connected now. Okay. All right, we've got more and more connecting. That's brilliant. I'll give you a few more moments so that we can get set up, and then the next one will be a bit quicker. But we'll give you a little bit of time so that you're all connected properly. Okay, great. So, as per the slide, which of the 3 most appropriate? Pick the 3 most appropriate in order of priority. Okay, so I can see that we've got results coming in. So we've got loads of people connected now, which is great. So we should have a smoother go round next time. But can we share the results of the Slido, please? Yeah. Okay. So you seem to have it. It is B, D, and C. Okay. And the reason for that is, first of all, your first concern in this scenario is patient safety, and the law and the standards around this is you cannot take blood without consent, because that would technically constitute battery. And then what you're thinking about with D and C are your communication and team working skills and preventing this problem in the future. So that's what we're looking at. What the guidance says, and I'm not going to go through all of it, but I'm just going to take that top point, is, and this is from consent guidance, that when patients lack capacity, a choice that you make must be of overall benefit to them. So this isn't about the risk to Dr. Prava in this question. Now, the risk to her is still important, of course it is. That is accounted for with trust policies and board policies around needle stick injuries. But in terms of testing blood, in this scenario, the patient doesn't have capacity, so you can't do it unless it's going to be of overall benefit to the patient. Okay. But it looks like you went for the right answers broadly there, so that's really good. Let's move on to Farah and Amy now. Okay. So again, I'll let you read that. So you're her GP, and clearly clearly you want Amy to be tested. So what approach are you going to take? Think about that first. What ethical issues are there here? So based on that, now start looking at the responses, and this time pick the two most appropriate. So use your Slido again. So if we can launch the next poll. What are we going to do? So connect to the Slido again. There we go, I can see connections coming in. It's a little bit slow today for some reason, but we're all used to tech travails these days, having lived through this pandemic. So which two are the most sensible? Okay, we've got a number of connections now, so let's have a look at the results. Don't know if they are if they can be shared on screen. And the answers in this instance are B and C. And I'll run through why with that. Because when you are thinking about disclosing information, you need to think about three factors in particular, if you're going to boil the standards down to three factors anyway. And those are, have you got consent? In this case, we haven't got consent. Now, that doesn't mean that you can't work with FARA over time to get consent, but in this scenario, that might be a possibility. But first of all, have you got consent? If you've not got consent, does the law require you to disclose the information? And there is no law in statute that requires you to in this scenario. So what you're looking at is the public interest test. And with the public interest test, I'll run through that. That's where you're using your professional judgment to think about the benefits to an individual or society, so clearly the benefits to Amy to get tested versus the possible harm, in this case, to FARA. She's clearly very, very concerned. Now, there's another factor that weighs in here, and that is the wider public interest in a confidential medical service. So in practical terms, what that means in this scenario is if you lose that trust with FARA, then she might stop presenting. She might get lost to follow up again. And indeed, more broadly, if any medical service, whether it's sexual health services, whether it's a GP practice, whether it's the sexual assault referral centres that I work in, if they get a reputation for being leaky with confidential information and people stop presenting, that is a wider public interest confidentiality issue. So that is why in this scenario, just going back to it quickly to remind you, and I'll flick through it again. What you're looking at here is you're getting advice which doesn't breach FARA's confidentiality, and then you're working with her over a few weeks. Now, if that doesn't work, then you'd escalate. But in this scenario, as it stands, you don't breach your confidentiality. You explore what else you can do. I should say as well, because I'm viewing the slides, I will look at questions that remain unanswered as we go through, and I'll stay on to answer those. It's obviously with lots of questions coming in whilst running through the slides, it's difficult to keep an eye on both. So back to this scenario, an example of some of the things that can help you. This is one of the learning resources that we have on child protection. So it just is a simple flow chart that gives you a very, very clear route around when you share information. And if you're interested, there's great great guidance as well from the likes of Beaver and Bash on children when parents have, for example, HIV. Okay, so moving on to the next scenario, meet Sally. So she's in for a termination of pregnancy. And it is really, really, really clear to you that she's concerned, that she probably doesn't want this abortion. But you can see what the nurse says. And there is a signed consent form that Sally signed previously. So what would you do? And I'm not going to share the options with you until you've had a moment to think. What would you actually do? Sally's in front of you, senior nurse saying, it's fine, let's just go ahead, there's a signed consent form. What are you going to do? Now, let's have a look at the possible answers, and this time it's one of the two most appropriate. Again, they're not in order of priority. So go onto your Slido tab. And let's have a look at this question. It's come up now, so just go onto the tab and connect. And pick the two most appropriate. Okay. Right, so we've got a few connected now. Start popping your answers in. And let's share the results. Okay, so the answers this time are E and B. So of course you want to have that more detailed conversation with Sally, and you need to escalate it now so no harm happens. So speaking with your reg straight away, and you can take it from there. And I think the answers align with that. So the things to consider from the standards, and again, I'm not going to quote the paragraph at you, but to boil the paragraph down, you need to think about coercion. And it's very, very possible here that Sally has been coerced by her well-intentioned mum in this case, but nonetheless coerced. And additionally, you need to think about what truly informed consent is. Does she understand everything? Has she given really informed consent? And by the sounds of it, she has not. And then finally, when it comes to capacity, one of the problems that we see is when we have, for example, patients with learning disabilities, or maybe patients with dementia or whatever it may be, there can be a presumption of incapacity rather than capacity. But we have a responsibility to maximise capacity in those circumstances, and that's what the guidance tells you. Okay, so think presumption of capacity, not incapacity, which is a problem that we see. Okay. And you'll know this, I expect, from your teaching. These are the things that we need to think about. And I get forever frustrated when I hear sometimes people say, well, this patient has fluctuating capacity, or has overall, this patient is incapacitous. Bringing it back to the Mental Capacity Act, what matters is capacity for a specific decision. Okay, so always keep that in mind. Right, so moving on to the next scenario. Okay, in this scenario we're going to change tack quite a bit, and we're going to look at gifts and bequests. So in her will, you've been left 10,000. Now, where are your ports of call? What are you going to do? Think about that first. Okay. And here are your answers. So if we can load the next Slido poll, please. Brilliant, thank you. And connect up to that. And this time it's ranking, as you can see, in the most appropriate, by order of priority. Okay. All right, I'll give you a few moments for that and just have a quick scan of questions. I've got one question. I can see that some people are having tech issues. I'm really sorry about that. It seems fine on my end, but I'm sorry to see that. But just looking through some of the questions, is this a common question format? Yes. You do have the full ranking ones, but you also have the choose the 2 most appropriate, 3 most appropriate. It's a mixture. Yeah. And on the best interest point, if she didn't have capacity, Victoria, I'm genuinely not sure what to do if she didn't have capacity. Well, with that, if you have a look at our consent guidance, it takes you through best interest decision making processes. And with best interest decision making, you need to consider, as far as you know, the wishes, feelings, beliefs, values of the patient, and wider information, decisions that they may have made before they lost capacity, etc. But again, as I was saying before, it's the standards. They give you the route to follow with anything like this. And looking at Kiana's point, a detailed conversation can elicit useful information about what their preferences are, which matters when it comes to best interest decision making. Okay, and let's go back to this question. I can see loads of people are connected now. So thinking about the gifts again, let's have a look at the results. Put those up on screen. Okay, so this is the full ranking question. And in this case, it starts off with B, that you can't accept, of course, as you'd expect. Getting a view, getting some support, getting some help from your medical defence organisation is eminently sensible. And then, of course, the next best option is seeing if there's anyone else that the gift can go to, as in D, asking if she had any relatives. And then finally, the worst option of all is accepting it, but for the hospice rather than you as an individual. And that's the worst case scenario. It's not something that you would realistically do when you've got all of those other options. But given that this question asks you to rank everything, clearly that's the worst option. You start with the best bit. Okay. All right, so moving on to, again, taking a different tack now. And this one's around raising concerns, really. Okay, so clearly your immediate concern here is patient safety. So you've got a patient safety concern. What are you going to do? So think about realistically what you're going to do. The specialty trainee has now left. You've been asked to do this. What are you going to do? Take a few moments to think about that first. And now I'm going to share the ranking options with you. And again, this one is a full ranking question. It's funny, isn't it? As soon as someone asked whether this was the usual format of picking just a couple, we've got the ones which are full ranks. So rank all of these. If we can launch the Slido to match this question. Great. And we'll give you time to get connected to the Slido. And whilst you're doing that, I'll look at chat again. Right, it looks like you can't see the slide with the answers, and I'm not sure why, because they are moving on my end. What I might do is reconnect the slides. I'll stop sharing and reshare and see if that makes a difference, because I think a few of you are having the problem. Okay, and I can see that Health Careers Live very helpfully said that this is recorded, so you'll be able to look at that. And of course, I'm more than happy to share the slides so that you can review them at your own pace as well. So that's absolutely fine. But I'm just going to stop sharing and then reshare, and we'll see if that makes a difference. Okay. Now, in the meantime, you've got the answers for the last question there, so hopefully you've at least got the question to answer. And now, with all things being equal, okay. Right, let's see if this is going to work.
And then what'll happen?
Okay, right. People are saying that that is, and apparently you can see it on YouTube, and it's working on YouTube for some reason, but it wasn't working on the platform. But it's good to know that those who are using the platform rather than YouTube can see the answers. So that's really helpful. In the meantime, let's continue with this. I'm really sorry about the tech difficulties, but as I've said, these will be shared with you. We now know that the YouTube stream is working well, and there'll be a recording as well. Okay, so hopefully you can now see the answers around the drug question. Let's share the Slido answers to see if you answered correctly, and I'll run through what the answers should be. So as you can see, hopefully, it says EBDCA. So the rationale around this one is the question is looking to assess how you manage the patient safety issue. As I said, the first consideration with this question was patient safety. So what you're doing is immediately trying to get hold of that reg, that specialty trainee. Okay. And then the next most appropriate, if you can't get hold of the specialty trainee, is of course another senior colleague. If that isn't available to you for whatever reason, but can I just reassure you, realistically in practice, there is always going to be someone that you can go to. Okay. But if that isn't available to you, then the next most appropriate is the ward pharmacist, and then ultimately, if there's no one and you're working in a void, which, like I say, is not realistic, there is always someone. But if you are working in a void, then you know that you shouldn't be prescribing, so you would decline from prescribing. Okay, and A is just you wouldn't do it, but therefore it's right at the bottom of your ranking. Okay, right. So moving on to the next scenario. I'll let you read that. Okay, so in Sarah's scenario, she's been asked to prescribe for her girlfriend. And it could be any friend, family member, etc. And the question is, are you going to, what's your advice going to be? Can you prescribe? So if we can launch the next poll. And it's just a yes, no. Now, this isn't an SJT scenario in terms of it would be a ranking, but you know what you're going to do. Remember what I'm saying in terms of prep, think about what you'd actually do in reality and then retrofit what you would actually do with what the nature of the options that they're giving you. So what would we do in this scenario? In these specific circumstances, can Sarah prescribe? And see people connecting to the Slido. And in the meantime, I can see colleagues at Health Careers Live have put the YouTube link on as well, so that's really helpful. Okay, we've got a load of people connected now, so make your selection. Can she prescribe? And let's have a look at the results. And it's very, very, very few people that have said that she can. In this scenario, she can't prescribe. So whatever array of ranking questions you would have been given, you would need to go with the one that says she can't prescribe top, and only the bottom option would be where she can. You can prescribe in emergencies for friends and family, but only in emergencies. And in this particular scenario, the reason that you can't is because there are loads of options actually, because she's not flying straight away, she's not in an emergency, so there is time for out of hours GP to send a script to the pharmacy, and pharmacists can actually prescribe in these scenarios as well. So there are plenty of opportunities available that mean that Sarah won't have to breach what is para 13, which is wherever possible, you must not prescribe for friends or family. So let's move on, and this time this is again another patient safety scenario that is linked to raising concern. So I'll let you read that. Okay. So this type of thing is not uncommon, to say the least, being pulled left, right and centre in different directions. Okay. Being asked to do things outside your competence. Those are two areas that are really, really common. So in this scenario, let's load up the next Slido poll. Hopefully you've already thought about what you would actually do. Remember, retrofit what you would actually do to the ranking. And again, this time rank all of them. Okay. Let's see. Oh, there we go. Should be able to see the answers now. And hopefully with this one, you can see that patient safety is coming first. You're speaking to the consultant away from the patient so that there is reassurance there. If they're not available, then it's finding the other colleague. It's similar to the other one. If they're not available to actually do it whilst you observe, then you could be supervised. If it comes to it, then telephoning the specialty trainee for advice, but realistically we're not going to get to this stage. And worst case scenario is again, clearly we're realistically not going to get to this stage. That's my challenge with SJTs. Some of the options in the ranking, and you will be thinking this whilst you're doing it, you're never going to do that, but the ranking is set up that way. Okay. Right, so final one to look at then is Mr. Baker. I'll let you read that. Okay. So just as I was saying, this is one of those scenarios where now you, rather than your consultant, is getting pulled in to do other things, okay? So what are you going to do? Think about it first. This question has also clearly got communication and teamwork implications as well. So how are you going to maintain patient safety and manage the very, very challenging communication teamwork issue here, because clearly you should not be spoken to like that. And this time, the example question is 3 most appropriate. So can we load the final Slido poll, please? And I debated when I was writing this, do I keep all of the options in? Now, originally, this actually had another option, but that's the longest one I've ever seen. But it does exist. It was one of the past questions. So that's why I've left so many options. So that's why you need to really have in your mind what you do in reality, so you can match what you do in reality to what's there. It is ridiculously long, isn't it? Okay, so I can see some people are connected. And let's see, which ones are you going to do? Okay. Right, so with this one, it's B, C and G. So with the rationale here, it's looking at that teamwork scenario, but first of all, patient safety is what matters. So the colleague on duty, who's going to be on duty, it's appropriate to ask them to do it. Okay, and then there is an underlying issue here. So that underlying issue around communication needs to be picked up, which is why you've got B, C and G, but that's the C and G are the more sensitive ways to approach that. So that's why we've got them. Okay, so we are at time, and that was happily the last scenario. So I'm just going to finally share some resources with you. The link there is to past foundation situational judgment test papers, and as I say, there are loads of learning materials in addition to the guidance on the GMC website as well. So please avail yourselves of those as well. I'm really sorry that we've had tech issues today, but I will hang around and look at the questions if there are any that remain unanswered, and happily you have got the link for it for the recorded version later if there wasn't anything that you were able to see, and the slides will be shared that way as well. But it was a pleasure, and I hope that it's been useful for you, and hope to see you properly sometime once you've all passed your SJTs. Thank you very much.